Hello everyone, today we'll discuss about the case of whooping cough or the pertussis. Whooping cough is caused by the Bordetella pertussis, a highly contagious bacterial infection that spread via respiratory droplets. Symptoms: initial stage mild cold-like symptoms such as runny nose, mild fever and sneezing. Paroxysmal stage with severe coughing fits followed by a whooping sound, vomiting after coughing and fatigue. Convalescent stage, the gradual reduction in the coughing episodes over weeks. Laboratory findings: nasopharyngeal swab or aspirate for the PCR or the culture to detect the bacterial pertussis. Elevated WBC count with the lymphocytosis, and treatment include the antibiotics, macrolides such as azithromycin or the clarithromycin to reduce the severity and contagiousness. Supportive cares, hydration, oxygen therapy, and monitoring for complications like pneumonia. Thank you.